This is Dr. Scott Geller, Fort Myers, Florida, laser floater ophthalmology, and we have a patient from Fort Myers. I saw you, was it 3 years ago the first time?
Correct.
Something like that. And you have a macular degeneration condition called geographic atrophy. Basically, there's been no treatment given to you for that, has there?
No.
No. And you've been seeing a very prominent ophthalmologist, Dr. Paul Ruskauskas, a brilliant guy here in Fort Myers, but there is still no definitive treatment for this at this time.
Correct.
Now, when you came in, you had a fairly large hyaline opacity of the vitreous face. And what was that doing to you?
It completely obliterated my vision.
Well, what vision you had? And your visual acuity was like, on the eye chart, you could barely see maybe 2150 or something like that, 2200.
Oh, right.
It was marginal. It was marginal.
2200.
And what activities could you not do?
Well, it was hard for me to watch television. It was hard for me to play cards. And I had a struggle just to do anything of that nature.
Right. And that was basically when that opacity was there. Could you shake it out of your way a little bit?
No, absolutely not. And I couldn't get rid of it. It was there, and it was there to stay.
Well, it always moved a little bit.
Yeah,
of course.
Within my eye, right.
Yeah.
It would never go away.
Yeah, exactly. And it tended to gravitate towards whatever central best vision that you had, and when it was there, it really made a difference. And like I was telling you before, for the average person, it might not have. It's a little blur, but when you're at a marginal, visual acuity, it put you over the edge, right?
Correct.
And at that time, we did laser. I did several sessions of laser. And what was your experience afterwards?
After the laser treatment, I was able to see TV, and I'm able to play cards, and it's a complete change from what I had before. I mean, there was no opportunity for me to enjoy anything, and now I enjoy it all.
yeah, and I just saw you again. You had some opacities there, fibrillar masses, which occasionally happen in the vitreous, and for the average person, I think it wouldn't have made a big difference in their visual functioning, their overall functioning. But in your case, it was enough to put that marginal vision over the bad edge, you might say.
Correct.
And the funny thing is, there was just a paper written on this stuff, and a lot of this ophthalmologists in Boston's patients had what's called a placebo effect. You don't think that you're imagining this, do you?
Absolutely, positively not.
Okay. Well, I'm going to be giving a lecture to the Florida Society of Ophthalmology next week. It's June 6th, I think, 2018. I'll be doing that in Orlando. And I'm going to have a link to your particular situation. I don't think they really understand that there are marginal patients that can benefit from this. It's like, well, your vision's so bad anyway, what the heck is this thing going to do? I think that was Dr. Ruskauskas' attitude. And maybe he thought, you were imagining this. But you're not imagining this.
No.
Okay, not. So there you go. You got to believe the patient.
Right.
It's one of my mentors in residency said, don't believe, what you're told all the time. Listen to the patient. And so we're listening, and I'm glad you're a happy patient.
Thank you.